Hi Jim, my name is Katie. I'll be your student nurse today. Are we aware of what electrolytes are? No? Okay. Minerals within the blood and body, they are essential for nerve conduction, muscle function, and fluid and acid imbalances. First, we have calcium. Normal range is 8.8 to 10.2. The purpose is to reflect parathyroid function, calcium metabolism, and malignancy activity. Factors affecting this may be drugs you've taken beforehand, including calcium supplements, which we ask you not to take 8 to 12 hours before your test. Hypercalcemia can be caused by hypothyroidism, cancer, or thyroid toxicosis. Signs and symptoms include muscle weakness, fatigue, and nausea. Hypocalcemia can be caused by acute pancreatitis, kidney disease, or malnutrition. Signs and symptoms include muscle cramping, tingling in the hands or feet, and seizures. We ask that you don't take any calcium supplements 8 to 12 hours before, and the tourniquet will be on as briefly as possible. For magnesium, the normal range is 1.8 to 2.6. The purpose is to evaluate kidney function, electrolyte status, and metabolism of magnesium. Factors affecting this could be calcium gluconate or a variety of other drugs that falsely decrease results. Hypomagnesemia can occur in diabetic acidosis, chronic kidney disease. Signs and symptoms include tumors, seizures, arrhythmias, and muscle cramping. Hypermagnesemia is due to dehydration, Addison disease, and use of antacids containing magnesium. Signs and symptoms include decreased deep tendon reflexes, bradycardia, and hypotension. We ask that you fast for at least 4 hours before the procedure. Phosphate, the normal range is 2.7 to 4.5. Purpose is to measure energy production, bone health, and acid-base balance. Factors affecting this could be low levels caused by certain drugs or seasonal variations. Hyperphosphatemia can be caused by hypocalcemia, fractures in the healing stage, or cirrhosis. Signs and symptoms include muscle cramping, bone pain, and itching skin. Hypophosphatemia can be caused by hyperparathyroidism or diabetic coma. Signs and symptoms include muscle weakness, respiratory failure, and irritability. Before the test, we ask that you document any catastrophic events that have recently happened, as this can increase your results. Potassium, normal is 3.5 to 5. Monitors muscle function, especially the heart and nerve transmission. Factors that can affect it are drug usage, such as IV administration of potassium penicillin, leukocytosis as well. Hyperkalemia can occur in conditions such as kidney disease, Addison disease, and cell damage. Signs and symptoms are muscle weakness, cardiac arrest, and numbness. Hypokalemia can occur in conditions causing diarrhea and vomiting, severe burns, respiratory alkalosis. Signs and symptoms include muscle weakness, cramping, and fatigue. Instruct the patient to avoid opening and closing the fist during the drawing of the blood, and afterwards, we're going to monitor you for hypokalemia or hyperkalemia. The anion gap, normal range is 12 to 4. Unless potassium concentration is used in the calculation, then it's 16 to 4. This identifies causes of metabolic acidosis and monitors renal function. Factors affecting this are most commonly starvation or medications. Increase in anion gap is associated with increased metabolic acid within alcoholic ketoacidosis or DKA. Signs and symptoms include thirst, lethargy, and weakness, may be associated with, decreased in ion gap may be associated with multiple myeloma, bromide ingestion, or hyponatremia. Signs and symptoms include headache, muscular twitching, and nausea. Sodium, normal range is 135 to 145. Purpose determines the acid-base balance and fluid balance. Some factors that can affect it are drugs messing with sodium levels, corticosteroids, iron, heparin, diuretics, renal blood flow as well. Hyponatremia is caused by heart failure, hypothyroidism, and severe burns. Signs and symptoms can include nausea, headache, and confusion. Hypernatremia is caused by dehydration, coma, and Cushing syndrome. Signs and symptoms can include thirst, dry skin, and lethargy. And chloride, normal range is 96 to 106. Purpose of the test measures the amount of chloride in the blood, helpful in diagnosing disorders of acid, base, and water balance. Factors affecting results can include IV saline infusions, which may raise levels. Hyperchloremia can be due to dehydration, Cushing syndrome, and eclampsia. Signs and symptoms of hyperchloremia include high blood pressure, increased respiratory rate, and weakness. Hypochloremia can be due to factors such as severe vomiting and burns or heart failure. Signs and symptoms include muscle twitching or shallow breathing and hypotension. And we ask that you fasted for 8 to 12 hours before getting this test taken.